Oppositional defiant disorder, a presentation by Astrid Skinner. What is oppositional defiant disorder? Oppositional defiant disorder is a mental illness that happens when a child or teen is defiant, disobedient, and hostile towards authority figures for a continuous period of time. And in this case, a continuous period of time means longer than 6 months. This mental illness is an externalizing disorder, which means that unlike many other mental illnesses, the effects are felt more by the people around the person with the disorder than by the person with the disorder themselves. What are the characteristics and DSM-5 clinical features of oppositional defiant disorder? Part 1. The first characteristic is that the child has to have a pattern of angry/irritable mood, argumentative/defiant behavior, or vindictiveness lasting at least 6 months, which is shown by exhibiting at least 4 symptoms out of the following 3 categories. And these behaviors also have to be shown to at least one individual who is not a sibling, such as a parent or a teacher. The first category is angry/irritable mood, and the symptoms for this category are they often lose their temper, they are often touchy or easily annoyed, and they are often angry or resentful. The second category is argumentative and defiant behavior, and the characteristics for this category are that they often argue with authority figures, or when it comes to children and adolescents with adults. They often actively defy or refuse to comply with authority figures or with rules. They often deliberately annoy others, and they often blame others for their mistakes or misbehaviors. And the third category is vindictiveness, and the only characteristic of this category is that they have been spiteful or vindictive at least twice within the past 6 months. What are the characteristics/DSM-5 clinical features of oppositional defiant disorder? Part 2. The second characteristic is that the disturbance in behavior is associated with distress in the individual or others in his or her immediate social context, such as family for younger people or co-workers for older people affected by the disorder, or that it impacts negatively on their social, educational, occupational, or other areas of functioning. The third and final characteristic is that the behavior does not occur exclusively during the course of a psychotic episode, substance use, depressive episode, or a bipolar episode, and the criteria are not met for disruptive mood dysregulation disorder. How prevalent is oppositional defiant disorder? The lifetime prevalence of this disorder is about 10%, and there is a little bit of difference depending on gender, so it's a slightly higher chance for boys to be diagnosed, about 11%, and a slightly lower chance for girls to be diagnosed, about 9%. And since this disorder is not as highly researched as other more common mental illnesses, I cannot really find any information about the annual prevalence of oppositional defiant disorder. What are the biological issues underlying oppositional defiant disorder? The first biological issue underlying this disorder is a child's temperament, which is something that a child is born with. It's essentially a personality, and some temperaments are more difficult to deal with than others, and they are more likely to be diagnosed with this disorder, and this just makes it harder for them to control their emotions throughout their life. The second is that neurotransmitter levels often affected with this disorder, such as serotonin and norepinephrine, which can cause changes in mood and thinking processes. What are the psychological issues underlying oppositional defiant disorder? Some of these psychological issues can be rage and frustration, low self-esteem, persistent negativity, and there's also many psychological disorders that often co-occur with oppositional defiant disorder, such as anxiety, depression, ADHD or ADD, bipolar disorder, autism, intermittent explosive disorders, and different types of substance use disorders. What are the social issues underlying oppositional defiant disorder? Some of these are social isolation, an inability to make or keep friends, delinquency, and many academic consequences such as bad grades or suspension, expulsion from school. What are cognitive issues underlying oppositional defiant disorder? Some of these issues are becoming quickly frustrated very often, having difficulty concentrating in school or in other situations, and not thinking and being impulsive before speaking. What is living with this disorder like? It is hard to describe how this disorder affects the person diagnosed with it because of the fact that most of the symptoms are more felt by the people around the person with the disorder than by the person with the disorder themselves. However, many diagnosed with this disorder say that they don't really desire to be hostile or deviant or defiant, and it almost feels like an addiction or something that they absolutely have to do. And many of them also struggle with relationships, especially with the person who is affected by the disorder the most, such as parents or close family members. And they often struggle in other social aspects of life, such as making friends or in school. And they're often affected by other psychological disorders, so of course that affects them as well. And the people around the person with the disorder say that it feels like being almost in an abusive relationship, and they feel like they have no control over the other person's actions, and sometimes saying they feel like a bad parent. So it can really have an effect on these people's self-esteem. What causes oppositional defiant disorder? Oppositional defiant disorder, as many other mental illnesses, is caused by not one factor, but by a mix of genetic, biological, and environmental factors. So, genetically, this disorder is more likely if a closely related family member, such as a parent, was also diagnosed with this disorder. And it's also more likely if the parent of the child with this disorder also has other mental illnesses or a substance use disorder. And this, talking about the parent having a mental illness or a substance use disorder, can also come into play later for the environmental factors. Biologically, this disorder can be caused by irregular levels of neurotransmitters in the brain, such as serotonin, that can cause changes in mood or thinking processes that can cause some of the symptoms of oppositional defiant disorder, such as irritability. The environmental factors of this disorder can be caused by a dysfunctional home life and exposure to violence, physical, sexual, or mental abuse, neglect, a lack of parenting, a lack of parental involvement, or inconsistent parenting, such as punishing a child for something once and then not punishing them for it the second time. How is oppositional defiant disorder treated? So, one of the most popular treatments for this disorder is by using the cohesive family model. And in this treatment, it is believed that the child's disorder is more caused by the parent than by the child themselves, because their behavior is being reinforced by ineffective parenting practices. So, for example, when children show aggressive behavior, the reason they're showing it is because the parents have shown aggressive behavior towards the child in the past. And this model works by attempting to change how the parents react to their children's antisocial behavior so that way the children don't copy them. Another effective method of treatment for this disorder is by combining parent management training, which is when parents are taught to reinforce pro-social behavior and ignore antisocial behavior, and teaching the child social problem-solving skills. Unlike most disorders, normal talk therapy is not normally effective, such as cognitive behavioral therapy or family therapy. And 54% of the people with this disorder receive treatment, which is higher than normal mental illnesses. And this is because of the fact that this disorder affects the people around the disorder, around the person diagnosed with it so much. Thank you.